what a we get a lot of question about what a GLP-1 is and how it works. So whenever people talk about the weight loss medications, there is different names and different brands. We utilize a compounding pharmacy that creates our compound, and it's considered a semaglutide. And you might have heard of trizipatide. That is another one that we carry, and there is a new one on the market that we also are bringing on. But the best way to describe this is the GLP-1 slows down the gastric emptying, which means you aren't able to eat as much. You can't overindulge. And in general, then over time, your body actually will lose weight. And I tell people this is not a magic medication, but when it was originally put on the market for diabetics, this was a side effect that they saw. So the positive to this is not only does it work for weight control, but it also is amazing for inflammatory response. As well, and for people with gut health issues. So it's more than just a single use medication.
Uh-huh.
So if this is something that you're interested in, what we do is we have you come into the office for a consult. The biggest thing with the consult is we want to see if you are a candidate for this. We need to have blood work done, and it is called a CMP, which is a complete metabolic panel. Most people already do have it, but if you don't have it within a year of your appointment, we'll write you a script, and then you can go get that done. We actually will be able to read that blood work. We check your family history and make sure that you're still a candidate. We'll check your BMI. And originally, when this medication was put on the market, the only people that could qualify were people with a BMI of over 25. But now, because of all the ancillary amazing effects of this medication, there are exceptions to the rule. And so, even if your BMI is below 25, you are a possible candidate for this medication as well. During the visit, we'll educate you. We'll talk about how to give yourself this medication, how the medication works, what to expect from the pharmacy. And then once the pharmacy actually sends you the medication and all the needles you need directly to your home, we then will start by setting up a follow-up appointment to track your progress and then go from there. So we're with you for the whole journey, and it's not just a medication. We'll talk to you about eating habits. We give you a list of possible personal trainers or nutritionalists, but this is the first stepping stone into a healthier lifestyle. So the biggest questions that people ask us is what are some side effects from this? And some of the biggest ones that Christopher's listed on our slide is the nausea, constipation, dehydration, dizziness. And then the last one is if the weight comes off too quickly, they lose volume in their face, and then people were calling Ozempic face. All of these side effects actually can be negated with proper technique and titrating your medication up from what we give you a chart of a lower dose. You follow the chart, and every 4 weeks, your dose goes up. And that'll help for the nausea. It'll also help if you are drinking enough water, the constipation as well, if you drink enough water. So all these things we can negate by proper education. And if there is a true problem and somebody's a little bit nauseous, we can order you a Zofran, or we can discuss choosing a different GLP so we don't have to keep you on the medication you start with. So this is really a nice handhold to the journey, and we really do customize it for you individually. And the weight loss isn't something that necessarily happens overnight. I use my daughter as an example, who just hit her 50-pound goal, and my husband, who had lost 85 pounds and within 3 years has kept it off by staying on a low maintenance dose. So I tell people this isn't a magic wand. You know, we do talk diet, we do talk exercise. This is just part of the journey for you.
And that is why these results do tend to last over time. A lot of people ask, like, what do I get off of it? If you do get a chance to learn portion control, and you get a chance to learn what foods agree with you and don't agree with you, you can help those results sustain themselves.
Katie, is there anything you want to add that I may have left out on this particular topic?
Yeah, I was going to add to that, same as Chris was saying, being that it's low and slow, you are learning those behavior modifications that then carry you into the maintenance phase. And I have several clients that have totally weaned off the medication and are maintaining their weight. And then I have some clients that are a little nervous, and so they're on a low dose or a micro dose, as we call it, just for a little bit of that food noise or portion control.
And for those of you who don't know, we were talking about this in the office today. What food noise is, some people are born with the extra noise or internal monologue about waking up and what's for breakfast. Can I have a snack after breakfast? And before lunch, I can probably squeeze in a banana and a handful of peanuts. But at lunch, I want to make sure I don't overeat because I have a large dinner later. If that feels familiar to you, it has changed a lot of our clients and me personally, and helped mute that food noise. I wake up now, my first thought isn't what's for breakfast. My first thought is I should walk the dog. Let me get my stuff together, things like that. All right, let's take a little commercial break. Let's hope a video works. Fingers crossed.
Hi everyone, I hope you're enjoying your semaglutide and Sculptra presentation. My name is Jamie and I just wanted to quick tell you a little bit about NAD. NAD is what I like to call the fountain of youth. It is really good to use it in combination with all of the weight loss medications. It helps with your metabolism and weight loss. It helps with your skin and energy. It's really good for everything. So, into the Wellness Center and we can start you on your NAD journey as well.
So Jamie has six children, maybe five.
Five.
So I didn't want to make her get on a 6 o'clock call with us tonight. But she is now the queen of medical injections. I think both Michelle and Katie have tried the NAD. How are we feeling?
Great.
Um, yeah, I was just gonna say I'm on week 3. So Katie and I are actually both doing the injectable form of NAD. There's also options to do IV as well in office. One thing I do want to say about the NAD, because I spoke with a couple clients today and they said they purchased the oral form online. The oral form will not work. Your only options with NAD is an injectable form or IV. And NAD, if you guys want to look it up, it truly is the fountain of youth because it works on a mitochondrial level. So it's actually rebuilding our cells. So keeps you youthful.
And then it's something we can administer in the office via IV or have it sent home with you. It is also one of my favorite things to say out loud what NAD stands for. And
They
it's in nicotinamide. I can't even get it. It's complicated. Don't look it up.
Katie, can you pronounce it? Because I have not tried.
I've only know the first part, the nicotinamide.
Okay, that's good.
Yeah.
We'll get back to you on our proper pronunciation.
Nicotinamide adenine dinucleotide.
It's intense.
There you go.
Thank you. Thank you. That was good.
Right. Katie, let me get your slides together. All
Okay.
right. So one of the big misconceptions we have is that if you lose weight too quickly, you end up with what's called Ozempic face, which is not an actual side effect of Ozempic or GLP-1s, but it is a rapid loss of fat cells and collagen. Katie, can you talk to me a little bit about Sculptra?
Course. So, like Chris was saying, the Ozempic face, they're relating to the medication itself, but you can lose fat with any type of diet. So, Sculptra is what we call a biostimulator. So, when injected, it helps to stimulate your own collagen production. So, you might have lost fat in your face, but we can help improve the volume loss with collagen. So it helps with volume, but it also helps with skin integrity, with wrinkles and texture.
Go to the next slide. Let's get a little deeper. I know it's a PLLA. What happens
Mhm.
inside the body?
So it stands for poly-L-lactic acid. So the particles break down when injected. It actually comes in a powder form. We reconstitute it with a bacteriostatic water. So we can inject it and look at the volume that we're injecting. And the body breaks down that particle, but that's when the magic starts to happen. So when I inject Sculptra, I always say, this looks amazing. You're going to love it. But when you wake up tomorrow, that's going to be gone. But that's when the magic happens and your body's starting to build its own collagen.
So take me through where you can use Sculptra.
Yeah, so Sculptra When I'm looking at how to replace volume, I consider Sculptra or I can consider fillers, which are hyaluronic acid. With hyaluronic acids, I'm looking at a certain filler to say to fill the temples or a different filler for the cheeks and the lips. With Sculptra, I like to call it global rejuvenation. I can take 1 or 2 vials and rejuvenate the entire face, excluding the lips and the forehead. For a global appearance, for a more improved volume stimulation. So I love Sculptra. It's one of my favorite things to do. With 40-year-olds, you typically need 1 vial, and anyone in their 50s or above, we're looking at 2 to 3 vials per session. And on average, it's 2 to 3 sessions for usually about 4 to 6 weeks apart, and then a yearly maintenance treatment.
So I'm going to jump into this as well because
Yeah.
Katie and I are both in our later 50s. And other than having a little bit of filler in my lips, Sculptra is the only thing that I have in my face. I think it's created more of a natural refresh because it is a global rejuvenation. And I also tell my clients it's like a 401k. It's investing in the skin and it's investing in your future. So it's a good option.
I love that.
Can you just touch upon the difference between Sculptra and filler?
Yeah, so as I was saying, Sculptra is going to stimulate your own collagen production, and it is a more natural appearance where filler adds volume, soothes out lines and wrinkles. Sculptra is going to help, like we were talking earlier, with texture and elasticity. It addresses volume loss. Treatment lasts about 2 years, and visible results can be seen 6 to 8 weeks after your injection. And then filler attracts a little bit of water. We call it hydrophilic, so it draws a little bit of water. And I am, again, just targeting specific areas instead of a global rejuvenation. And results for a hyaluronic acid can last anywhere from 6 months to 1 year.
I love that. Side effects and risks.
Yeah, bruising is always possible. Anytime we enter the skin with a needle, bruising is one of the side effects. Sometimes a little swelling as well. It is non-reversible. Once we place it in the skin, it's going to work to do its job. And addiction to results because they're amazing.
That's my favorite.